We have Jason Tuori and Sam's here as well. Jason, thanks for joining me, man.
Thanks for having me, Chris. This is a big deal for me. Second time on the podcast, which means I think at some point I get like a velvet jacket, right?
That's right. Yeah, third time, Sam. What do we give Jason?
I don't know, but I'm feeling like we made a joke about golf before we aired. But have you guys ever seen like the Masters jackets that
Oh
they give?
no.
Like we might have to make a version of that,
The ugly green ones? Yeah, for sure.
Yeah, I'm
or like
good.
a sweet bomber jacket.
Oh, the nice varsity
Jason,
jacket. I'm down for that.
All right. We'll brainstorm. We'll come up with
Yeah.
something good.
Jason, so you already mentioned you've been on once, but could you give another kind of intro on yourself and any updates from last time we talked till now?
Sure. So I'm a sports physical therapist and sports performance coach based out of Rochester, New York. I did a sports residency training at URMC here in Rochester. Spent a year after that in the working as a sports performance coach for RNYFC in the MLS Next Pro League. And currently, I run a virtual performance rehab consulting business where I work with a lot of endurance athletes, both from the PT side and from the run coaching and strength coaching side, as well as I'm the strength coach for University of Rochester men's and women's cross country teams. So I would say good portion of my week is running related for sure.
Noise. Did you mention the podcast really things? Did you say PT Inquest already?
I did forget to say that. There's a lot going on, Chris. I'm also the one of the hosts of PT Inquest Journal Club podcast that's been running since before I started hosting, but I think like 11 years or something, somewhere in that ballpark.
Yeah, I was thinking that before we got on. Do you think Eric has, as a PT, the most amount of audio hours online on a podcast?
I think that's likely. If not him, then maybe Jack Chu from Physio Matters podcast, just because of how long that one's been running. But I mean, we put an episode out, but not like a 45 to 60-minute episode once a week. And given there were a few years where it wasn't like once a week, every week of the year, I got to imagine Eric's voice is just like saturating the radio waves.
For sure. So today, our primary talk is going to be shoe related, performance and injury risk. So you know a lot about shoes. Can you discuss when and why you even started diving into the interest and the passion for running shoes in general?
Yeah, I would say that personal interest played a very big role as to the why I dove into it. Honestly, as growing up as a middle distance runner who's raced up and down from the marathon distance and former running shoe salesman in college, it was always something that I like to nerd out about. Sam made a surprise face there. I think that was news to him. Um, so yeah, I think the foot and footwear also tend to attract people that are really interested in biomechanics. Maybe a little bit more in that area than other areas of the body for some reason. Not really sure why. And sometimes to the detriment of ourselves, given how much it might matter in the grand scheme of things. But I suppose we'll get into that a little bit more later. Um, but then really, I got into it even more when I became a physical therapist and started seeing more runners. It seems like a pretty commonly held belief, both on the runner and the practitioner side, that shoes are related to running injuries in some way. And I suppose maybe you're going to ask me about that, aren't you?
I am. Let's dive into it now. So the biggest question we're going to start with, do shoes actually reduce injury risk?
Yeah, this is a common question. My feeling is probably not overall. There's a really nice review from 2020, I think, by Laurent Malisu, who's really well published in this area. And it's essentially a summary on how inconclusive that question is and how inconclusive the research leading up to this point is on that. I think we have to first recognize that running injuries as a whole represent a complex system. The complex system is the web of interrelated variables where you can change one of those things in the input and get an unexpected output. Uh, Now, when we talk about the output, we're actually just saying running injuries overall. And I think we need to break that down even further, because that assumes that all running injuries are created equal. And to my knowledge, the only consistent variable between all running injuries is the presence of running. Every individual injury is going to have an individual risk profile. So now you could say, well, do running shoes reduce, let's say, foot and ankle injuries? Because that maybe has the best face validity or plausibility. That's getting a little bit closer, but now go back to the complex systems thing. And is it not possible that by changing one thing, let's say we change something and it reduces foot and ankle injuries, you might actually just increase something else, say hip or knee injuries? And this is, this idea is fairly consistent in running, where a lot of the things we do just shift stress from one place to the other. So maybe we might reduce the relative risk of something, but the global risk stays the same. And even then, I don't know that I've seen enough to convince me that running footwear can reduce foot and ankle injuries. So this is like, it's taking several steps, several logical leaps to get to that point, for me to say, yeah, my feeling is probably not overall.
When you were a running shoe salesman, did you think it mattered a lot more?
Oh, dude, I was in it. I was drinking the Kool-Aid. I was this college kid running, thought he knew everything about shoes, thought that the classic treadmill analysis, you see somebody pronate. First of all, we we do a treadmill analysis without shoes on. So, oh wow, look at all that pronation for this person who never runs without shoes on. You must need a motion control shoe now, because I saw you pronate this much, or a stability shoe because that felt like a bit, but not too much, or wow, those are some high arches that aren't really moving too much. I guess you just need a neutral shoe. I was all in it. Yeah, for sure.
So I guess that begs the question then, should you be buying your shoe based on your running technique? Like, is there validity for a stability shoe for pronation or a neutral shoe for a high arch?
So I'll start with the easy one, which is using static foot type to determine running shoes. And this, we've got some very large scale military studies on, NAPIC in 2014. This is the systematic review meta analysis on matching motion control, stability, or neutral shoes to static arch height. And this saw no difference in injury rates. So we can at least move past the static assessment and go to the dynamic assessment now of watching somebody run and pairing the shoe to that. And the assumption that we get on running technique is, well, let's say you're not actually watching someone and you just ask somebody, are you a forefoot or rear foot striker? Runners are not actually knowledgeable about their own technique. So most people who think that they're forefoot strikers are actually mid to rear foot. This was a subjective survey based study a few years back. And the other assumption is that we're actually good at measuring running technique, and so some might be, but a treadmill analysis is, you kind of have to be really picky about it as far as like the actual angle that you're setting up the analysis, the amount of time, the warm up, the standardizing conditions. So, like I said about myself previously as a college student in a running shoe store, filming people running barefoot on a treadmill, that was actually probably not the best way to just measure someone's natural running technique in the first place. But let's make all those assumptions and say you've accurately assessed someone's running technique. I think we may not realize how much the shoe influences running technique as well. You put somebody in a minimalist shoe and they might be closer to a mid to forefoot runner. If you put them in a motion control shoe, it's probably going to be a little bit harder to do that. So, yes, the shoe influences it, but overall, I think I'm really more of a fan of the comfort paradigm, and this is just the comfort is going to guide running shoe selection. So you go to a running shoe store, you pick 3 to 4 pairs of something similar to what you already have, if you like what you already have, or if you don't like what you already have, grab bag, 3 or 4 pairs of shoes, try them on, see what feels best. To be fair, I think we we can and should be critical of this comfort paradigm as well, because we don't know that it's actually a superior method for selecting running shoes for injury reduction, for performance. But in the absence of a better alternative, another system to point towards as far as matching up running shoes to the individual, this is my preferred for now. And I'd be willing to change my stance on this in the future given different evidence. But that's kind of where I'm at.
Does that comfort paradigm change at all from a top end performance perspective?
That's an interesting question. So we'll start with performance as a whole here. So performance, easy to measure in running because it's just covering a certain distance at a higher speed. That's hard to argue. Unlike other sports where we talk about, what does it actually mean to improve performance? It's fairly straightforward in this sport. So that's nice. This is going to very quickly spin off into the whole super shoe, carbon fiber plate shoe thing. Let's do that first, and then I'll talk about whether they feel comfortable or not. We've got about 7 years of race data since the original Nike Vaporfly prototypes came out to say, yes, they seem to improve performance. Mechanism still debated, probably has to do with 3 things: the type of foam that's used, the shape of the carbon fiber plate, and the overall geometry of the shoe. So the Pebax foam is the new type of foam. This is Walter Hugamer, the Roger Kram's group, did the original couple studies on the Nike Vaporfly 4%. This was in the Colorado lab. That foam shows an 87% energy return. And for reference, TBU, which was commonly used up to that point in some of the high performance shoes, that shows about a 76% energy return. And EVA foam is around 65%. EVA is the stuff that's in like everything. The second part is that curved carbon fiber plate. And it's important to delineate curved carbon fiber plate versus just they slapped a carbon fiber plate in and now everybody's springboarding around. The curved carbon fiber plate, helps to reduce the energy demands at the MTP joints and at the ankle. And it doesn't seem to shift it anywhere else as far as what we know right now. So unlike the thing I said earlier about work just going from one place to the other, the Vaporfly, at least in a couple of studies that have been shown on those super shoes, doesn't really seem to do that. It just reduces the band at the MTP and ankle. The curved geometry or curved shape of it is what allows that to happen. So there was a study, I think by Owen Beck, a few years back, that just compared a few different types of carbon fiber plates straight. I think one of them was curved, and then one of them was like partitioned so that it could actually flex. And it's not just a carbon fiber plate that tends to do this. There's something about the geometry there. And then the overall geometry of the shoe, which is this kind of like rocker bottom or curved high stack shape. The high stack allows you to pack a ton of that energy resilient foam in there. Resilience being how much energy it can kick back. Resilience is energy, energy kickback. Compliance is how much something actually deforms, as terms there. And then it allows you to put that curved carbon fiber plate right into the midsole. And I think a couple of years after they originally came out, there was a 40 millimeter stack height regulation that was made by World Athletics for road performances. And they cut this down to 20 millimeters for track races, which is why you see like the quote super spikes are much lower in profile, but still have a kind of the same rocker geometry and higher stack than you had seen in the past type construction. So performance-wise, yes, these can improve performance. We see this improvement in running economy as a result of these. So anywhere from like 2 and 5 or 6% in a lot of these studies. And that doesn't directly translate into 2 to 6% of running performance. There's kind of this relationship. Shellac Kip had this modeling paper where the faster you're running, the lower the performance benefit for a given percent improvement in running economy. So say you get that 4% boost in running economy at a very high speed. you don't get quite as much of a performance benefit as at a very low speed because of things like oxygen uptake and air resistance. Um, so that theoretically means that the slower you're running, the better your performance is with these super shoes. But they do seem to matter pretty significantly.
So, two quick questions on that. Number one, maybe we should clarify when we say super shoe, what we're talking about, and if all super shoes are equal. And then after that, is the statement on the super shoes possibly being beneficial at slower speeds still relevant? Like, is there a cutoff point? Because I know I've seen a lot of ultra runners discuss not feeling it's beneficial because they don't feel like there's much return with the carbon fiber plate kickback and stuff.
Yeah, so the super shoe in general is this nickname for any of these marathon or long distance shoes that have come out since 2016 that have a very high stack height. So the stack height is just the difference in height between the insole, which is right underneath your sock liner, and the outsole, the hard rubber at the very bottom of the shoe. They all tend to have this kind of curved shape, as I pull on my little show and tell here. And they all have some form of plate in them. Not all of them are carbon fiber curved plates. Some of them are nylon. Some are TPU. And they all generally have that same geometry, but the Nike Vaporfly prototype was the first one. And then that first shoe on the market became the Nike Vaporfly 4%. Yeah, the thing is, we still, even though they've been out for 70 years here, we don't have that much research on them. There are some like large scale race data that compare the pre 2016 to post 2016, and you see this like, okay, yeah, there was something that happened there. I think they do still seem to help running at slower speeds. I mean, there's nothing that I've seen that shows a like you need to be this tall to ride kind of cutoff point. I think the consideration for ultras is more what the surface of the race is going to be. So if you're talking about trail versus road, that's going to be a little bit different. We can get into that if you want.
Yeah, we could probably do that in a minute. I was more referencing, I don't know if you know Camille Herron. I think that's how you say her name. She's so like all the major female world records for most distance covered in 24 hours, 48 hours, 100 miles, all that kind of
gotcha.
outrageous stuff.
The real outrageous stuff. Yeah.
Yeah, and like she's discussed it in depth, and she's actually a physical therapist and a biomechanics researcher. She specializes in bones, though, and she's been quite vocal that she noticed a detriment to her distance performance when doing the longer distances in carbon fiber shoes, and so she switched away from them a year or two ago.
Yeah, I think my first thought on that is the discussion of responders versus non-responders, which you see in the research on the super shoes so far, which is when they do release all of the individual participant data, it's not that everybody improves by 4%. Somebody might decrease by 1%. Somebody might increase by 8%. And so you see on this group level, maybe there's a 2 to 6% improvement, but there are still individuals that just seem to be non-responders to these for some reason. The same way that we see something similar in strength training for runners as well. There's this like some people benefit a lot, some might not benefit at all. My other thought on that is how far away your preferred shoe was when you switched over to this carbon fiber plate shoe too. Because that could probably play a role. It's if you're used to either very little support or a lot of medial lateral support, and now suddenly you're in a high stack but relatively medial lateral unstable shoe, force production is going to decrease if we feel unstable. That's like something that we know from strength training, something we know from sports performance. So if somebody doesn't feel stable in them, that's not going to be a more economical shoe, I would say, which probably also goes back to Chris's initial question about comfort in the performance shoes. And I don't actually know the answer to this. I think it's probably a pretty good question if you got a handful of individuals that said that they felt uncomfortable in those shoes and then tested out their performance, tested their running economy, had them do a time trial. I'd be really interested to see what would happen, because I suspect some would actually still probably do better, and some would not feel very good in them and not run very well in them.
Yeah, I think I can be a good discussion on that one, where I've historically ran in minimalist shoes, and I have done reasonable in them. And then I made the transition to using a Vaporfly after a toe injury, and I actually had a performance boost. And I was like, okay, well, this is a interesting experience, and I'm going to have to take that into account when I want to start pushing my performance. Okay.
Yep, the future is here.
If someone's brand new into running and they have all the money in the world and they're like, you know what, I want to pay for the most expensive type of running shoe, is there a downside for someone going straight into a super shoe? Or is it like, you know what, try it out. If it feels okay, keep doing it?
That's my thought. Is again, like I don't think that there's this barrier to like you need to reach this point before you can do this. They seem to improve performance. So my only concern would be if somebody was switching from kind of drastically from like one type of footwear that was much different, and then suddenly doing all of their runs in a new type of shoe. But that concern would be consistent with any two types of shoes that are far apart from each other as well. Um, so yeah, I'm for it. They just need to recognize that 250 to 275 US dollars gets you about less than 200 miles of running. So accept that at your own risk.
Yeah, that was going to be the next question for mileage. Isn't there kind of like a common trope of like change your shoes every, what is it? It used to be 500 miles or
Yeah.
what are your thoughts with that? You said 200 for these super shoes. What does that even mean? And does it matter?
Yeah, these are this is that rule of thumb, like change your shoes every 500 miles, is actually based off of a very small number of engineering studies on foam. Some not even on shoes themselves, but just on EVA. And these are relatively old studies, and now we're building running shoes out of things that aren't EVA anymore, and we probably don't exactly know the mechanical properties of them. There is a failure point where the foam will not return the same amount of energy that it did when it's new. And that's where like EVA of that 65% energy return after 400 to 500 miles, it is not that anymore. It's actually starts to decrease in the 200 to 300 mile range. The main thing that tends to happen with newer, lighter shoes is that the outsole wears out first. And the outsole is very, very thin because it adds more weight to the shoe. If they put this like huge rubber tread on the very bottom of an otherwise very light shoe, it would negate the weight benefits that you get out of that shoe. So they put the minimal amount necessary of outsole on there, and once you chew through that Pebax midsole just starts getting absolutely destroyed. It is not a very strong foam, so it's extremely compliant as well. So the reason the carbon fiber plate inside the foam thing helps is because it adds a longitudinal stiffness to the shoe. If you just had that foam, if anybody's ever put on like the Nike Invincible, I think it's called, it's that foam, but it's with no plate in it, and it just feels like you're kind of squishing on a cloud or an Airax pad. Feels very nice, actually. I like standing in them. But yeah, it has a lot to do with once you chew through the outsole, the midsole's days are numbered. But there is probably this, if you had a shoe with this new Pebax foam and you put a ton of outsole on it, I don't actually know how long it would last from an energy resilience standpoint until it started to decrease, because that doesn't exist right now.
You had mentioned with the super shoe with the plate, it's reducing the forces on the toe and the ankle. Is that correct?
Yeah, so it reduces energy absorption at the first MTP, and energy absorption and energy propulsion at the ankle. So the role of the midfoot or the intrinsic foot is largely as a spring dampener during running. what we see from a couple lab studies is that the faster you run, it just keeps absorbing more and more force, but it doesn't keep releasing or contributing to propulsion anymore. The propulsion levels off, the absorption increases. So the foot is kind of a spring dampener. And when it transfers energy more up to the Achilles, that has kind of more of a traditional, the faster you're going, the more propulsive load on it, and also the more energy absorption through it. But you're saving energy at the first MTP, which is kind of the anchor of the intrinsic foot, and the ankle, which is, of course, the powerhouse of running, the Achilles.
What about a more minimalist shoe compared to like a maximalist, like a Hoka? What, from a energy absorption, propulsion, and just stresses to the joints, does anything change from those two ends of the spectrum?
Yeah, so it probably helps to first compare like a traditional running shoe, let's say a neutral shoe, to a maximalist shoe. There doesn't seem to be much of a difference between maximalist and traditional running shoes, other than maximalist. There's an arbitrary, like, yeah, if it's got a really high stack, we call it maximalist. To my knowledge, there's not a number of like, once you hit 30 millimeters or something, it is deemed maximalist. A few studies have shown actually increased impact peaks, loading rates, and eversion moments, comparing maximalist to traditional running footwear. Impact peak, so when you think of like vertical ground reaction force during running, it looks like a mitten. So there's like this thumb that comes up first, then a tiny dip, and then a bigger like handed glove thing that comes up. So the impact peak is like the top of the thumb. That's the initial vertical ground reaction force from the initial contact. And then the top of the rest of the glove is actually just the peak vertical ground reaction force at mid stance. So the maximalist shoe shows a slightly larger impact peak. How relevant is that? Hard to comment on. Loading rates would then be the kind of rate of that force development of the impact. When we get into the minimalist, we usually do define these in a few major categories. So there's high flexibility through the shoe. This is both longitudinally, so if you like grab the shoe and then folded the toe towards the heel, and then like a torsion flexibility as well. Yep, Sam's got his nice little demonstration here. You have a relatively low heel to toe drop. So typical in a minimalist shoe is going to be like 0 to 4 millimeters. Heel to toe drop is just the difference in stack height measured from the heel and then measured from the forefoot, usually right at the ball of the foot, first MTPs. Traditional running shoe for reference is going to be in like the 8 to 12 millimeter range. 12 was standard for a very long time. Relatively low weight for a minimalist shoe. This is also kind of relative. There's no real cutoff point here. Relatively low stack height, also fairly relative. And the absence of other motion control and stability devices. And these would be things like a medial posting. The medial posting is like, back in the early 2010s, you used to see on the inside of the shoe this like really dark gray, hard material. And it was like this really nasty scarlet letter that showed that you were a dirty pronator. And they've kind of like baked that into the design of the shoe at this point to make it look not as gross. But that's like part of a motion control or stability shoe where it's trying to reduce the amount of eversion in the foot. And then other stability units like a shank. A shank is like a hard TBU plastic bar across the very bottom of the foot, typically below the arch near the outsole. So minimalist shoes have like basically the more minimalist it is, the less of all that stuff they have. And so because there's this spectrum, there's the minimalist index is a reference that I use a lot from the running clinic. They're based out of Vancouver, right, Sam?
Well, they're based originally in Quebec, but JF, who I assume you know,
yeah.
JF is actually in Kelowna, the city I live in.
Yep. So I like that minimalist index because it does take into account these 5 variables. The obvious flaw is that it weights them all equally. So everything is weighted 20%. That's acceptable. But you can kind of like put a number or grading on a shoe based on this index here. Minimalist shoes, after all that, have been shown to decrease loading at the patellofemoral joint. but also increased loading at the ankle and MTP joints. So this is a really good example of us shifting stress from one place to the other as far as our running interventions or our running changes go. And it's really hard to isolate the different aspects of designs and shoes too, because you see like, all right, of those 5 different variables, what if it was just 1 or 2 of those that was the important thing? And now we think it's all 5 of them. Laura Malisu's research has done this a few times with heel toe drop. I believe they controlled for the weight of the shoe and did different heel toe drops. I think they did the compliance of the shoe. They did like a soft versus firm shoe that was of the same weight, but nothing really seems to consistently point towards anything from an injury standpoint at a group level. That was the question, right? Something about minimalist shoes.
Yeah, so it sounds like maybe not that it all washes out, but there's so many factors in when you change a shoe and whether or not that's actually changing anything, because you're also changing these other areas. It's hard to say.
Yeah, and I would say,
yeah.
right. It's hard to say. I still think it's very plausible to say that the quicker you change from something like on one end of the spectrum to the other end of the spectrum, the more likely you're going to have some issues because you just drastically changed a loading profile, which is why the typical rule of thumb is like, all right, use that index, and for every 10 to 20% difference, take X period of time to work your way into that thing full time. It's just kind of like a pragmatic, don't do too much too soon approach to it.
Let's go into more of the clinical context where a patient is coming in for an evaluation, and let's say they're a runner, and if we need to use 2 separate examples, we can, but they're coming in for some type of running related injury, and they ask about their running shoes and for you to assess their ankle and feet. And let's keep it at an ankle or foot related injury. What, obviously there's a lot of context of where this could go, but generally, how much emphasis are you placing on the specifics of their running shoe itself, their foot itself, etc.?
Yeah, I would say there are 2 reasons why I probably look at somebody's shoes during an assessment. One is to leave no stone unturned, just as far as listing all of the potential contributions to why somebody might be in pain or has some issues. The other is to build a therapeutic alliance if there's somebody that also likes talking about shoes. I will look at their shoes, not to take any specific information about their wear patterns, because it doesn't typically tell me very much, but to kind of gauge on how beat up they are and if they've completely chewed through the outsole of them. Shoes do have a lifespan, as we mentioned. As far as kind of like general shoe recommendations, I'm probably still diving into the have you changed anything recently? The vast majority of my assessment is still about load management. And you can say that shoes play a role in load management, because if somebody has made a change recently, then they have changed a loading profile. And now structure X, whatever foot ankle structure you want to say, is either loaded more or less than it was previously if they've made that quick jump there. So yeah, I'm looking out for a recent change in something, and probably also to just assess what their belief is on it. If they feel very strongly that I just switched from one shoe to this one and now I'm hurting, I'm probably going to say, have you tried just putting the other shoe back on?
Yeah, so what if they ask about you watching their running during the eval, or if that's making much of a difference? And is it similar where you just want to build some type of early trust and therapeutic alliance, but you may or may not change anything that initial eval?
It's definitely that as an overall baseline. I would say if somebody is in active pain, I'm not typically putting that much stock into their running analysis so much as maybe using that gait assessment as a way to trial an increase in running cadence. How does this affect your symptoms? Use something like a symptom modification rather than analyze their running gait while they're in pain and try to draw any information about whether this is what they looked like before they were in pain, or this is how they look like while they are in pain, which is probably not inherently that helpful. Um, the other aspect of a running gait analysis is like we want them on a treadmill probably for like 10 minutes total anyway. So if they can't run pain free for 10 minutes, it's not really that worth doing. I would say it's probably a good amount of let's look for symptom modification in the early stages, and then once someone's out of the woods, let's look at the analysis, and then let's also tie it back to a number of these other tests that we're doing off of the treadmill, because human movement is complex and we move through space in ways that we don't always expect.
What about patients that have, let's say, interesting looking feet, where maybe there's some type of major bunions, there's some type of like almost crossing over of different toes, and they ask, do I need to consider a specific type of shoe, or is this going to impact my ability to run moving forward?
Yeah, that's a good question. I mean, typically the width of the toe box is going to be, we think, is what contributes to like some of those midfoot, neuromas, bunions, things like that. I would say if they have pain, that's an area that I'd like them to explore typically. So, in the interest of modifying someone's symptoms, compression over their MTPs, not typically something that's super comfortable for someone with first MTP pain. So that even right there going to be like, okay, have you ever tried a wider shoe? Have you tried a brand that has a slightly wider toe box? Other than that, I think it's probably difficult to say without a specific case, right?
And then if a patient in general asks about how much local foot and intrinsic foot strengthening do I have to do as a runner, or I heard that I have these big maximalist shoes and I'm going to weaken my feet, how do you respond to those type of questions?
Yeah, this is a really this is an area of my interest for sure. Is the how much foot strength do we need? There was a study that compared a home exercise program of intrinsic footwork to just walking around in a minimalist shoe. I think it was like 1 hour a day over a period of 2 or 3 months. I can't remember all the details off the top of my head, but it was like the end result was about the same amount of intrinsic foot strength. I mean, if I'm working with a first MTP pathology, a plantar plate tear, a turf toe, I do actually like to really go after big toe strengthening. But for the regular runner who's just like, how much foot strength do I need? Can they just get that out of running and doing calf raises or doing calf raises? I mean, maybe they can just get it out of running. Yeah, I mean, like I said, the main role of that intrinsic foot is to absorb force. So as long as you can absorb the prerequisite amount of force that you need over however many repetitions you need to do it, it's usually not something I go after, I would say, unless somebody's had a history of relatively chronic foot injuries.
So if you're going to go after big toe strength, is there a way for you to measure that objectively, like what their starting point is versus improvement?
Oh yeah, there is. So I like to measure it in two different positions. There's the ankle neutral with first MTP propped up to between 30 and 45 degrees. And this is going to give you your just overall peak measure of first MTP flexion. This is both contribution of flexor hallucis longus and brevis. And then I like to break that out into having them in at least 45 degrees of plantar flexion and doing the same thing. So prop the first MTP up to about 45 degrees of plantar flexion. This puts the FHL on slack. And I just use a handheld dynamometer and have them do 3 maximal effort first MTP flexions into it. So we measure that isometrically, and then we put them through the ringer, and then 4 to 6 weeks later, we do it again.
So, real quickly, when you test that, you're having the handheld dynamometer propped though, so that there's no slack in the system. They just push down against it, like
yep, yeah. So they're just it's on the floor, or like the dynamometer might be slightly angled upward, and I'm just supporting that handheld dynamometer with my hand so that it doesn't move. And then their first MTP is in contact with the ground the entire time, so that there's not a like an actual plantar flexion forced into it. We've played around with strapping the foot and ankle down too. That probably makes it a little more accurate, but takes a lot longer.
Yeah. Yeah. And I think the study that you're referencing is the Ridge 2019 one before. It's where they,
that's the one.
Yeah. And it was like a progressive minimalist shoe program. They started with like 2,500 steps, then 4,500 steps, then 7,500 steps. And the home exercise program is calf raises, toe curls, stuff like that.
Yeah, and same stuff you'd expect.
Yeah, the home exercise program did beat the minimalist shoes, but it was pretty close, which is impressive.
Yeah, I remembered it being like I remembered it seeing it and just thinking, well, if it's that close, I would just go with the shoes.
Yeah,
for the amount of time that you would have to take to do the other thing, and to be fair, like almost everybody I work with is going to get a pretty heavy calf raise anyway, and so I'm already kind of accounting for some stimulus that way. And then if it's a case where we're doing very heavy intrinsic foot strength, most of that is just the same type of first MTP isos, except with a loaded bar on their back, because the overall stress on the foot increases the more weight goes through it. It's really funny actually looking like you're about to set up for a heavy back squat and then just doing like big toe isos.
Yeah. I did a video on foot and ankle strengthening, and when I was talking to Mark and Tony about some of the setup for the exercises, and I was like showing them on live video chat, and they thought, for instance, like I was in a split stance version of that, and they thought I was gonna do a calf raise, and I just did like a toe curl.
Oh yeah.
And there's the anticipation of like, okay, when's it gonna start?
Jason, when you're measuring the big toe, are you looking for a specific number compared to body weight, or just a relative change compared to their starting point?
Yeah, I put most of the stock into relative change, given the fact that we don't really have good body weight norms for this. There are a few practitioners have kind of used like just anecdotal based on their practice. I've seen between 2.7 and 4 newtons per kilogram of body weight, and these are for higher level athletes, cutting sport athletes, and dancers. So I kind of keep that in mind, but the other difficult thing about measuring the foot sometimes is that there is this prerequisite need to learn how to do it first. Like you almost have to teach the foot how to move before then accurately assessing its quote unquote strength, because otherwise you're just measuring somebody's ability to move their toe around. They might not actually be able to push into it because they don't have the motor control to do that. So that's always going to be on a case by case basis of like, if somebody already knows how to do it, cool, we're ahead. If they need a couple weeks to learn how to just control their toe into the direction that it needs to go for us to get a valid measure of their intrinsic foot, then that probably takes a little bit more time too.
Can we dive into 2 separate case studies or examples of utilizing or changing footwear for kind of positive outcomes, and then flip side, we tried this as an initial intervention, didn't work out so well?
Yes, I actually have 2 very recent cases of this. So this was perfect timing. One of the more recent cases where it did work positively, one of my middle distance athletes with first MTP turf toe flare up following a workout. So I'm very much a fan of the let's see if we can offload it a little and still keep training approach as the first line of defense, especially in season for an athlete. So this runner in particular had track spikes in their rotation for miler workouts and an ultra shoe, which was fairly minimalist, as maybe like one other run day per week. So we basically just slapped on the beefiest shoes that he had for 2 weeks, pretty high stack and longitudinally stiff Hoka and Adidas shoes, and said, "Don't worry about times for these workouts. I want you to still just run to intensity or run to RPE." And he's with those stiffer longitudinal shoes, he was able to push the intensity without symptoms, none that lasted any longer than the kind of like acceptable 24-hour range or interfered with his next day of training. So that was really the only modification that we needed to do for that couple weeks where it was a little bit more flared up. And then we just gradually reintroduced the ultra shoes after that, and then introduced the track spikes after that. So that one made me look good. Now I can tell you the one that didn't make as much sense. This was a recent case of a Masters runner with a pretty long-standing FHL tendinopathy, which I also thought was a tib post tendinopathy until the MRI showed that I was wrong there. So that was strike one. His typical training shoe is a Saucony Kinvara, which is on the kind of on the minimalist side of neutral. It's like a beefier minimalist shoe, I guess I would call it. So he had to take some time off. It was pretty flared up, and when he returned to running, I had him switch over into his Hoka Cliftons, which are again these like pretty high stack, longitudinally stiff shoes. And he would usually run in these Cliftons maybe once every other week, but he would do a lot of his training in the Kinvaras, and that did not go well. He still had some symptoms in the early return to run program. So after a couple unsuccessful attempts, I said, just put the Kinvaras on. What do you have to lose, I guess? And he was able to pretty steadily increase his return to run intervals after that. So, in both of these cases, I think it's important to note the potential post hoc fallacy when something goes well and when something doesn't go well. So you can't really draw anything causative about it. It's like we did this and then this happened, which is why I'd never really feel that strongly about anything. But I suppose in this case, his body was just used to running with a certain load profile, and it worked for him, even though it might be the opposite of what we'd expect. This is very good timing because those two cases happened within the last month, and I was just like, that's something.
Yeah, that FHL tendinopathy and posterior tib mix-up is a very understandable one. I actually had the same thing last year where they have a lot of overlap in a lot of the presentation.
Yeah.
And I just didn't notice it at first.
Very bizarre too, because this individual didn't have any pain with like FHL heavy isometric testing. It was just all that medial ankle pain that worsened with going deeper into eversion. Just the same, the almost same overlap, which ultimately means is the treatment going to be that much different? Probably not too much, right? But I was still wrong,
with posterior,
and I'll own it.
Yeah. With posterior tib, like you wouldn't necessarily include great toe oriented movements, whereas with like FHL, you probably would benefit from it. So I guess like that's a difference.
Yeah, and there's the thought of like, well, both of these tendons, they might just settle down once you manage their loads and do all the other stuff, and then once you come back to them, they might be good again. Do you need to load them heavy? I still do, because why not? But yeah.
I was working with a sprinter who actually presented with this, and he was able to return back to like lower intensity running very easily. But it was the moment that he had to put the intensity on and had to go into his great toe to a greater degree, and it just kept flaring up every time. And it was just a confusing cycle of trying to figure out, the best gradual load ramp up. But then once we started to include heavier toe exercises, he found benefit to it because it was at least like this bridging point of introducing it.
Yep. Yeah, it makes a lot of sense.
Zooming out again to bigger picture, and you've alluded to this throughout, but if we're going to look at a hierarchy or a pyramid of biggest rocks to address and establish first, and least important, where maybe we just kind of list some of them, and then where in that hierarchy or pyramid is shoe selection?
Yeah, I think when you zoom out, the answer for shoe selection is probably on the lower end. I guess like pyramid is like lower is not as important, right?
Yeah, it's a great question. Sam, do you have
Because
any
there's more
to think that
surface area
through?
of the lower part of the pyramid.
Yeah, I actually made this kind of a pyramid, and I put shoe selection near the top, but
Ooh,
because I think that it's the later thing, like the base is like the most important stuff, right? I
yeah,
think.
it's like food groups or something.
Yeah, yeah.
The totem pole makes a lot more sense to me, but yeah. So I would say, as I alluded to, load management is my biggest fish to fry, so to speak. Um, nobody ever got a running injury from not running. So, like I said, it's the only common factor amongst all running related injuries. Um, all of these non-traumatic injuries can be traced back to some sort of too much too soon, whatever that was, and it probably gets traced back several weeks leading up to when the thing starts anyway, which makes it even harder for us to figure out. So I really dive into that, frequency of running, intensity of running, volume, recent changes, future goals, all sorts of stuff like that. Um, at the same time, I see things two ways. It's the like, what's the root cause? Let's do the long term work to get back there, and then short term, what can we do to keep you going? And that's probably where some of the shoe thing can fit into the mix. Like I mentioned about a couple of the case studies, um, the running cadence modifications, things like that, with changing, increasing somebody's running cadence a little bit if they fall towards the lower end of the border to see if it helps with their symptoms. um, I still maybe I question how much it does translate to overground running. I know we often do it on a treadmill in the clinic. We get somebody running to a metronome. I typically use I have somebody set their Garmin like cadence alert so that if it drops below a certain amount, it beeps at them, or if their pace goes above a certain number that is like faster than their typical run speed, then it'll beep at them too, so that they don't just increase their cadence by way of running faster, which defeats the purpose of doing the thing. Um, and then things like taping and shoes and uh, those are your like short term modifications that you try, and having somebody go try a massage or any of these other modalities. I think from the short term symptom management standpoint, if it doesn't cost too much, take too much time, go for it as long as the narrative isn't harmful surrounding it. But when you look at the grand scheme, it's going to be training factors and recovery factors. The recovery being things like your sleep, your nutrition, other life stress. So I think about training load and trying to determine whether this is really you spiked it up too much, or you just continued your consistent training load, but your recovery side dropped down. So it's almost like comparing two different types of stress fractures. You have the fatigue fracture and the insufficiency fracture. The fatigue fracture is where abnormally high stress is applied to normal bone. The insufficiency fracture is where normal stress is applied to abnormal bone. You can zoom out and just apply that to, is this an abnormal stress on a normal body, or is this a normal stress on a abnormally low recovering body? Um, and then there's always going to be stuff that we just don't know why somebody keeps getting an injury with. Maybe it's because they had the injury previously, which is the thing that recurs most in the research of, if you've had this injury previously, you're more likely to have it again. We don't understand why that happens. There's maybe because they never fully rehabbed it, or because they were just genetically going to be getting that injury regardless of what they did. Um, but of the things that we can modify, yeah, I think that the training load side of things for the getting back on track long term, um, versus the short term modification things to keep you training side. That's kind of the way that I think about it.
Do you have, this is purely subjective, do you have a least favorite type of running shoe, just that you're like, I just don't like the look of this situation? And is there a type of running shoe where you're a fan?
Oh, if we are talking about look, it's got to be Hoka's. Yeah, sorry everybody.
Least
Um,
favorite?
the color schemes are they're just awful. I mean, I will say if I'm on a heater, Brooks has some pretty terrible color schemes as well. My mom bought these like discount $65 Brooks Ghosts that had like purple leopard print on them, and I was like, Mom, what is this? And she just like couldn't care less because they were marked down. Um, yeah, those are pretty offensive. I would say in general, I do like the looks of Nikes. Pretty sleek. I've always been a Nike guy, but yeah, that's my stance on things. Feel free to come at me.
Well, it's a good thing you can't see behind me because I have like 6 Hokas right behind me.
What color are they, Chris?
Hold on, I'll pull them out. It's too far away. I got like
Man, I thought you were joking.
No, I'm dead serious. I have like a light. I have like a sky blue. I have these trail Hokas that are navy. I have pretty much all white ones. They're not that ugly. They might be.
I don't know.
Beauty is in
not
the eye of the
ugliest
beholder.
shoe company, but they are not very pretty.
I mean, if we're still taking shots, ultras do look pretty wild. They look like duck bills. But I do appreciate the wider toe box. I don't have a particularly wide foot, but it does kind of feel comfortable, and I do like often find the individuals who have a hard time finding wider shoes because that's a hard thing for people to find. The ultra tends to work out for them. Yeah, I have this. Somebody feel free to steal this business idea, but a running shoe store that's just for wide shoes, but like you get more than one brand. Like, because every brand has like one wide running shoe, and so you're like, okay, I guess I'll get the Brooks. Yeah, we need a little more support for the wider feet people.
One last thing that's just more of a tangent than anything. So your experience when you were a running shoe salesman and maybe the priorities you gave into things, but typically when people go into running shoe stores and what they're being told about their feet and the running analysis, I had a very similar experience when I went to go just buy a mattress recently. This lady like heavily critiquing my body. And she goes, well, what type of pillow do you use? And I said, you're not going to love this, but I don't sleep with pillows. And I nearly killed this lady. And and she goes, what side, how do you sleep? And I said, on my back, like I'm in a coffin. And I feel great. And it was just such a like, it's like I murdered her dog, that I don't have any spinal pain. I don't use a pillow. I just want a comfy mattress. But it's kind of similar to where it's like, find what's comfy. Stop judging the hell out of me. And I got a mattress.
Yeah, I will say I never like criticized anyone for their foot structure. I was a good salesman. Everybody, it's like, do you, but this is what I think will work best for you. But yeah, I could see the same type of overall thinking in mattress sales compared to footwear sales. Maybe there's something about foam that really just like it's the common thread amongst everything.
Totally.
So, Jason, you walk into a shoe store or you're browsing the internet, because that's probably more realistic nowadays, and you need a pair of new shoes. How do you decide the shoes you're going to buy?
Oh, I'm for sure a creature of habit. I'm the guy who's like really upset when they change one model like from year to year and they like change the structure of things. To the point where I think I've purchased on eBay like 6 different pairs of Nike Zoom Streak 4 LTs because they don't really make them anymore. So I mean, I do like to change up my running shoes. I have a super shoe in the mix. I have a minimalist shoe in the mix, a track spike, and then just kind of like regular neutral trainers. Some Nike Pegasus, the Nike Invincible, a couple Sauconys in the mix. The Endorphin Pro, I like to put some miles in for that super shoe. Just feels nice for a long run. So yeah, I tend to just like keep my options open by being able to run in a lot of different stuff, which I feel like is nice. Because I do race and track, I do feel the need to keep a spike or a minimalist shoe in the mix, but recognize that not everybody does need to do that. So if somebody's just wants to go long distance, they don't have to have their foot conditioned to a minimalist shoe. I feel like I probably should do that, especially at this age where I don't recover as fast or adapt to change as fast as I used to. But yeah, that's kind of my running shoe circuit.
Sweet. I think that's a great place to stop. Any other final thoughts, Jason or Sam?
Yeah, I think we beat it to death. Thanks again for having me on a second time. I'm not as looking forward to the golf jacket, but we'll see what happens.
Yeah, we may find something better. I'm just gonna ship you 20 Hokas.
I changed my mind about the golf jacket.
I'm pretty thrifty. Let me work on this. I'll come up with something good.
Yeah, thanks guys.
All right, thanks again, Jason.